So now I'd like to introduce Leslie Bortolotto, who will take over. She is an improvement facilitator with the Edmonton Southside PCN and did a lot of work with the Otwell Medical Clinic when they signed up for CII CPAR. Leslie.
Thank you, Dr. Craig. Good evening. As Dr. Craig said, my name is Leslie Bortolotto, and I am the improvement facilitator from the Edmonton Southside Primary Care Network. And I've been working with the Otwell Medical Clinic for the past 2.5 years. Otwell is located in Southeast Edmonton in a quaint residential area, and they are using MedAccess as their EMR. I would like to mention that they are the first clinic at the Edmonton Southside PCN to register with CII CPAR. So yay to them. They took the plunge. Dr. Ahmed is one of our physicians at Otwell Medical Clinic, and I've asked him to join us today to share his thoughts on how this initiative has benefited his practice. So Dr. Ahmed, before we start, would you like to share how Otwell Medical Clinic is a patient's medical home?
Sure, thanks Leslie, and thanks for having me on this program. So the Otwell Clinic is a medium-sized, fairly busy clinic. We have 7 physicians in-house. We have a large, complicated patient base who often have multiple comorbidities, lots of chronic diseases. We have a large elderly population in our area, and with a large population of mental health as well as cognitive disorders as well. We do also have patients who are English as a second language, which just makes things a little bit more complicated as well. So often these patients have multiple visits to the ER or to specialists, and often connecting the dots has been complicated. We've been fortunate to be connected with the Southside PCN in Edmonton, and we have in-house access to a nurse practitioner, behavioral health consultant, exercise therapist, dietitian, respiratory therapist, and our panel manager. These members of the team have been really helpful in connecting dots for us and being able to keep patients in-house whenever possible. We've been able to reduce the number of patients we've had to refer out to specialists for many chronic diseases as a result of that. Our patients really do feel that they are part of a community and part of a home, and feel that they can come to the clinic for most of their needs as well. That's it.
Thanks, Dr. Ahmed. Next slide, please. So I would like to take you on the clinic's journey to bridging the gap. So let's talk briefly about engagement. So I felt the clinic was ready because they had a very good panel identification, maintenance and management process. I spoke with the clinic manager, Elma, with the idea of CII CPAR. Elma agreed and suggested I presented at our next quality improvement meeting. So at that meeting, there were questions and concerns. Elma, could you speak to those concerns for us?
Hi, I don't do video well, so I'm going to try to do this for you people. Thank you very much, Leslie, and thank you all the other people that are participating in this. We had a meeting basically to discuss what CII CPAR was, and there was one doctor that was concerned about, what was the impact, what was the good of it, what benefit would be for the doctors or for the clinics. So with the help of Leslie, she was able to provide some information. She left a binder in our lunchroom that provided all of the information, like the mapping of the fields, all the examples that were going to be uploaded into CII CPAR. And this was very beneficial because each of the doctors and my MOAs could look at this and get some information. So with being reviewed by everybody, we decided to do the go-ahead, and the clinic decided to register for it.
Awesome. Thanks, Elma. So Dr. Ahmed, you and I discussed CII CPAR a couple of times after this meeting, and you seemed excited with the clinic moving forward. Why did you feel this way?
So Leslie, first of all, as I mentioned, I have a large, complicated population base at Otwell. I also work part-time at another clinic, Boyle Macaulay Health Center in the North Side, PCN. That's, again, a very vulnerable population. A lot of my patients are homeless and have addictions and mental health issues again. A lot of these patients fall through the cracks a lot. They're often, again, an emergency and often bouncing from doctor to doctor sometimes. And it's a real issue with my patients. And of course, they're not getting a good quality of care, and their issues are not getting addressed properly. So the thought of being able to connect the dots was quite exciting for me. The idea of being able to streamline the amount of work that I have to do was also quite attractive. The thought of being able to have better communication and better flow between the different healthcare providers and being able to get real-time information is something that was quite enticing as well. As was mentioning, that there is the idea that we will be able to get real-time consultation reports, or almost real-time consultation reports and discharge reports, hopefully, from emergency, would again be a very, very attractive concept that would be very helpful for my patients. So that's what kind of got me really going and excited about this program.
Awesome. Next slide, please. So let's talk about the effort involved to register. So on this slide, there are roles associated with CII CPAR, and the clinic had to decide on the team member or members who will take on certain roles. So there's paperwork involved, and the first role is the site liaison, who is the primary contact for the PCN and eHealth. This role will coordinate and assist to complete the necessary paperwork for registration. The access administrator manages panel enrollment, and the panel administrator handles the mismatch and conflict reports. So Alma, how did you decide who in the clinic would take on these roles and why?
We decided that because I have a small staff, I usually have 4 on staff, that in light of the processes and that were going to be involved, I would take it on as the main contact, evaluate the volume of work that was going to be involved in it, the amount of time it would take, and work you through the process to see which would work for all of us here at the clinic. And down in the future, I will probably release the reins to someone else, but at this time, I'm the main contact for taking care of it all. With your help, of course.
Thanks, Alma. So as the access administrator, you completed the registration forms, had your physicians review them, sign them, and then you did the submission. Did this take much time?
No, it didn't take a lot of time at all. Basically, there was a few hiccups, where we had to understand forms and the process and stuff, understanding the toolkit, which didn't make sense. There was some challenges on getting through the forms and that, but with the help of yourself and e-consultant, we found the necessary stuff that we needed, made it easier, and we basically had it done in about 2.5 to 3 hours.
Awesome. You're right, Alma. Because you are an innovative clinic, our concerns and feedback regarding the toolkit and the resources were shared with CII CPAR team. And I have to say, they did hear us. And these tools and resources were updated. We did make a difference, and we are paving a smoother road for the clinics to register. So in a few minutes, we'll dive more into the mismatch and conflicts reports. Next slide, please. So we're going to go through, now that the paperwork is done and submitted, we're going to move on to the onboarding and go live process. So this is when technical readiness is verified by eHealth and confirmed by you, Alma, the site liaison. Most of this work is done behind the scenes with eHealth. Did you have any trouble with the technical aspect or configuring your EMR?
No, because TELUS provided us with an EMR guide that we had to use, and there was some, stuff we had to do to tweak our EMR to make everything work for the processing of the paneling for the doctors and that. And with Gabe's help, we were able to work through this and configure the EM pretty easily. So it was quite quick.
Good. Yeah, I remember it wasn't too bad with all that configuration. So I remember we did some random checks in Netcare after we went live. And do you remember that we wanted to make sure that the data was uploading correctly to the Community Encounter Digest? So we wanted to make sure, and that's why we did those random checks. What were your thoughts about seeing this information? And did your physicians have anything to say?
Well, one of the main physicians that I had shown it to, he felt it could be valuable because looking at the information, like going into Netcare at a quick glance, you bring up the encounter and it shows, like providing everybody's onboarded, that this patient went here, or this is what this patient was seen for, and the diagnosis codes come up through quickly. So that kind of given him an initiative, like, hey, this really might work for us once we get more people involved in it. So I think the processing, the way it works through Netcare, everybody was quite pleased.
Good. Thanks, Alma. So let's briefly talk about the mismatch and conflict reports. So Alma, you worked on a process to handle these reports, which we've shown here. And does this process take you a lot of time? And do you find the mismatch and conflict report helpful for panel maintenance?
Yes, I do. I like the way that the demographic mismatch report, because it helps identify patients' information and if there's any errors between the registry part and our EMR, and it's easy to fix, whether it means we fix it internally or notify a patient that they have to contact the registry. It gives us a broader arrangement so the physicians are aware of where their patients are coming and going, and if we have to have conversations with them to find out where their medical home is. It really assists in a lot of different ways.
Good. Great. So it's good that our audience hears the benefits from you. Thanks, Alma. Next slide, please.
Thank you.
So the next step was e-notifications, which started recently in MedAccess. So e-notifications are automated messages delivered directly to the physician's EMR, and they're notifications about key healthcare events from the ER, hospital admission, discharges, and day surgery. The benefits is because you can see these notifications immediately. As Dr. Craig said, they're twice daily. And having the ability to contact your patient after an event is very beneficial. So to give you an idea of how many notifications Otwell Clinic handles, they receive approximately 4 notifications per day, and that's for 7 physicians. So Alma, did registering for e-notifications require any additional paperwork?
No, it didn't require any additional paperwork, and it went really seamlessly. Right now, we've started to do a process and decided who's going to handle it in-house right now. And after, about a month or so, we'll relook at it at our next QI meeting to see if someone else has to be identified or if we'll continue with the same process. Right now, we're going through the doctors with our nurse practitioner.
Right. So we kind of went through our first, we put a first cycle in our PDSA plan, right, Alma?
That's correct.
Thanks. So in our discussions, we worked with Gabe, our EMR consultant, and he's also our panel management assistant. So, and Gabe, I would like to know if you could talk about how the clinic is using their EMR MedAccess, and can you describe the importance of optimizing your EMR for initiatives such as this?
Right. Thank you, Leslie. So I'd like to just stress that it's very important to optimize your EMR for any process, and especially for this kind of work, it's even more important. Optimizing the EMR allows for efficient use of time and staff resources, as well as ensure that information that goes to Netcare from the map fields are to some extent standardized. Now, as far as the process that we see here goes, we observed the process at Otwell Medical Clinic, and we noticed that we could actually triage the e-notifications so that the most vulnerable population, as example, patients with complex care needs, will benefit from a more proactive care. So we are currently testing these processes and workflows to see if it's helpful, and we hope along the way to make some tweaks as and when it's necessary. Thank you, Leslie.
Thanks, Gabe. So I would like to share an example from Otwell. So it is important to know your patients had an event, as it gives the opportunity to follow up with them immediately. So e-notifications can enhance the transitions of care process. So Madeline, who is our NP at Otwell Clinic, noticed that she has more inpatient discharges from reviewing the e-notifications than what she has indicated on her transitions of care list. So these are good catches. So I'd like to just give you another example that is from one of our registered social workers that works in a clinic within our Edmonton Southside PCN. And she states, our current process only captures patients who have been confirmed as their patient by the hospital. Every doctor and nurse I've spoken to experienced patients being missed because the hospital didn't update this. Previously, we would call hospital admitting to change it if we found out and that the patient was still there. But some hospitals have started to refuse this update. A few weeks ago, in my registered social worker role, I had a homebound patient with dementia admitted to the Royal Alex Hospital with the wrong doctor listed. We have seen him in our clinic for home visits for 5 years. And they wouldn't update. The hospital would not update. They said it was a privacy violation. The patient has no idea we are his provider because he has dementia. So all the information went to the old doctor. Our current process also only captures patients who are admitted. So many can relate to finding out much later that a patient presented to the ED multiple times in the past year, but not being notified because the patient wasn't admitted. So if this clinic was registered with CII CPAR, the clinic would have received e-notifications when the patient was admitted because of the confirmed panel, even if the hospital had incorrect information on the primary provider. This is a great progress for primary care. Next slide, please. So as we reached our destination to crossing the bridge and bridging that gap, I'd like to ask Dr. Ahmed. So now that you are live on CII CPAR and you see the benefits of this, what would you say to your colleagues?
So Leslie, we've been on the system now for a few weeks and still getting to know it and getting used to it. I'm already getting e-notifications on admissions, discharges. And so that's good, and that's been very helpful and very useful. We're not getting information from other clinics and other physicians. I want to remind people that this program is a two-way street, and you have to have both parties connected and signed up for the information to be sent back and forth. So the hospitals are connected, but not a lot of the clinics. So what would be really nice is to have a lot of clinics connected and signed up so that there can be this sharing of information and communication. So the more doctors and clinics that sign up, the more this program will actually work and the more information we will all receive. So one of the things we're hoping for is that a lot of people consider signing up and get involved in this program. And the more, of course, we get, the more we can connect the dots with the circle of care for our patients. The one thing, of course, that I'm really hoping for is to get more details on reports, more details from specialists as well. Often, as we all know, Netcare can take a long time for discharge information to show up. It can take days or longer for the discharge planning to come out. And the same thing with specialist reports. So the idea of having almost immediate information being downloaded into our system is really, really nice. But again, everybody has to be connected and on board for this to happen. So that's my hope.